I have just some high-level overview points that I'd like to share with you around what's happening with numbers of cases, vaccination rates, boosters, what's on the horizon with testing, how is it going for those places that have instituted vaccine mandates. I am hearing that it's hard to hear, so I'm going to move a little bit closer and hopefully that would be helpful for the audio. But just to sort of dive in with where we're at right now, almost 71% of all the Pennsylvanians aged 18 and over are fully vaccinated at this point. We also, though, have a pretty significant increase in the rate. So we're looking at around 9.7% increase in those cases from the weekend. We have about 678 folks that are currently in intensive care because of COVID. And over the weekend, there was 105 fatalities due to COVID. So we're not out of the woods yet. Of course, the Delta variant has complicated efforts in vaccination, in addition to groundswell of misinformation that's spreading through, social media channels. So we are working against that type of misinformation. We have been able to take a look at our post-vaccination rates. So what we mean by post-vaccination rates, it's more commonly referred to as breakthrough data, and that it's looking at, of those folks that have been vaccinated, who's still getting sick and who is becoming hospitalized and who is getting positive cases. So we took a look at what we have available, and we know in September that folks that were unvaccinated were 3 times a higher risk of getting both a positive case, but also being hospitalized due to COVID. And then when we looked at the death rate from January through to the end of September, we saw that those who were unvaccinated were 6 times more likely to pass away from COVID than those folks that are vaccinated. This is not to say that vaccinations are completely foolproof and that folks will not get sick or die. There have been folks that have gotten sick that are fully vaccinated. There are folks that have died that are fully vaccinated. And I'm sure everybody heard the news of Colin Powell recently and understood that he was fully vaccinated and still passed away. But we do know, and the evidence is increasing, in that it really does protect against severe illness and fatalities. And we can see that with the data that's being compiled now, and it matches what's happening federally, what's happening in Pennsylvania, where we see that the unvaccinated folks are still at the much higher risk of hospitalization and death. 3 times higher for hospitalization, 6 times higher for death. So we're still trying to get folks to get out there and get vaccinated. There is still around 30% of the population that still needs to become vaccinated. So we're working a lot around hesitancy and building the resources to address hesitancy. We do have those available. We have specifically, there are hesitancy resources available on our PA Unites Against COVID site. We've also done a lot of work to just compile resources. We are working with PA Med. They've created a lot of great hesitancy videos in a lot of different languages, where there's a doctor speaking to the hesitancy points and debunking some of those hesitancy myths. We also have a lot of resources that we've compiled around addressing hesitancy specifically in pregnant people. We know that that's a particular group that has been more hesitant than others. And we also know that about 3 weeks ago, the CDC increased their recommendation for pregnant people from, a strong recommendation to an urgent recommendation for those folks to become vaccinated. And we have seen, unfortunately, folks that are pregnant and do contract COVID, pass it along, that it has created some issues with some of the babies that are born to pregnant people that have contracted COVID. So we're really working hard to try to address that in that group. So just to move on to where we are with boosters. And
before
Amy,
you move on, can I just, so two questions. The first one, you had said the percentage of Pennsylvanians over 18 who are vaccinated, that was 71%, is that right?
It's 70.7% as of yesterday.
Okay, good to be precise.
Yes.
And I know the hesitancy website, you and I had talked before we got on air, was there is some information at PA Unites Against COVID. That's its own website, is that right?
That's correct. If you, and I can just Google it and put it in the chat as well, if that's helpful, but PA Unites Against COVID has its own resource.
Okay, great. All right, thanks.
Sure. And I'm happy, to connect with you with any other more specific resources that would be helpful for the group.
Yeah, maybe we can touch base after, and we can get some of that and get it out to our members.
Fabulous.
Okay,
great. Anything else before I move on to boosters?
No, please go ahead.
Okay, great. So as I'm sure all of you know, Pfizer has been approved by the CDC director to be used in folks that are 65 and over and folks in high risk occupational settings for a booster shot. So this is different than the recommendation that came out for those folks that are immunocompromised. And just as a point of clarification, folks that are immunocompromised in this setting, it's different than what we might be thinking of from before when vaccines first came out. It's not just folks with diabetes or folks with high blood pressure. These are folks that are like in active cancer treatment. They're the level of immunocompromised that the CDC has recommended to get Pfizer or Moderna boosters is very different than what we might be thinking as immunocompromised in general in the public. Again, though, we're advising folks to talk to their physicians about this. But we have been working with the 65 plus community to make sure that they have access to those Pfizer vaccines. Folks in the high risk settings, in particular in our nursing facilities, making sure that they have access to those boosters. We've done a lot of work to make sure that they are connected to vaccine providers, and where there is maybe a gap, that we're connecting them to providers in their area so that they can administer the boosters. We do anticipate that Moderna and Johnson & Johnson will also open up eligibility to boosters. So on October 14th, last week, FDA's vaccine advisory voted to approve Moderna and Johnson & Johnson for the same populations for boosters. So the process is a little clunky. It has to go through the FDA's vaccine advisory and then through to CDC's vaccine advisory, which is called ACIP. And then from there, the CDC director will make a determination. So the next step really is that Thursday, the CDC's advisory committee will be holding a vote to determine whether or not folks should be eligible, who should be eligible and for what. So is it 65 and over, high risk settings like Pfizer, for Moderna and Johnson & Johnson? There is a little bit of conversation around whether or not they're going to be voting to mix and match. So if I had a Pfizer vaccine and I'm eligible for a booster, can I now get Moderna and vice versa? And how does Johnson & Johnson play into this? So we'll be able to get some really good information around the next steps on Thursday, which populations are going to be eligible. So that advisory group, though, that's not the final say. The final say is the CDC director. And we saw recently that advisory group and the CDC director kind of broke a little bit. So the CDC advisory committee stated that it really is just 65 and over that should get a booster. But the CDC director said, no, we're going to include folks in high risk and occupational settings as well. So just because the CDC advisories group says that this is the population and this is the dose and this is the amount, doesn't necessarily mean that that's set in stone. We need to wait to hear from the CDC director about what her final approval is. But that should all be coming pretty soon. And in addition to the booster information coming soon, we're also looking at the 5 to 11 eligibility opening up. So we anticipate that that's going to open up on November 3rd. And we've engaged with pediatricians to make sure that they're ready, willing, and able to administer vaccines. And we do hope to get that group vaccinated, as we know that that will help keep schools open, help keep quarantining down, and will help us all move toward our new normal more quickly. So we're looking forward to that. We, at this point, have seen the correlation between vaccination rates in communities and pediatric cases. So we've seen that counties with low vaccination rates have higher cases of pediatric hospitalizations. So we really are looking to push getting those vaccines, and then when we can, getting those kiddos vaccinated. So I was going to move on to how maybe you can request a vaccine clinic at your organization if you're interested.
I think that'd be fabulous. I think people would like to hear about that. Just one question about the kids. Is there any discussion about giving vaccines in schools, or is that going to be left more to the private sector?
We are going to be doing specific outreach to schools that are open and eligible. We have heard, and we are, very sober around this, that schools right now are politically, their hands are tied in a lot of ways. And some of the superintendents we've talked to said that there's absolutely no way that that the students' parents are going to allow that. So we're working also though with like child care facilities through the Department of Health to see if we can get them there in the after school settings as well, just to really make sure that we can reach these kids. So through their pediatricians or through school or the child care setting. Fantastic.
Okay.
Yeah. Thank you. So we have a link that I'm happy to share with folks. It's actually as soon if we are able to share the PA Unites Against COVID. When you click on that, you get two options that just pop up right away. And that is, I'm looking for a vaccine and I would like to host a clinic. So there's a form there that you can fill out that will help us connect you to a vaccine provider for you to hold a clinic. And what we ask is that, that the host partner does that outreach and make sure that there's enough of an interest and enough of folks that are willing to be vaccinated or get their boosters. And we are also suggesting, that folks get their vaccination or booster and their flu shot at the same time. The CDC has stated that this is something that is advantageous to folks. I mean, they would just give one shot in one arm and another shot in another arm. But if folks are interested in getting the flu and vaccine, we certainly recommend that happen at the same time if that's a possibility. And I see a question about, can you get a booster and shingles vaccine at the same time? That I'm not sure of. I would have to ask one of our specialists who work directly with the CDC to get that information, but I'm happy to do that. Does anybody have any questions about that, Amy, before I move on to testing and?
No, I think we're good. And I just want to remind, we are getting some sort of medical based questions. I just want to remind people that Faith is not a physician. So she's doing her best to pass along the information that she has from the state. But if you do have specific questions about mixing and matching boosters or, what can you get at the same time? I think there's some guidance out there about getting the flu vaccine at this, when you get your booster kind of thing, as opposed to getting other vaccines at the same time. definitely talk to your pharmacist, talk to your healthcare provider about that. And we are being asked to get the link about the flu, I'm sorry, the clinic information again. So could you just repeat that?
Sure. I'm going to find it now, and because I can do the quick, so that I can give folks this link right away. I'm going to put it in the chat.
Perfect. Thank you.
Okay.
And somebody did just chat in that what they were told by their healthcare provider about shingles and the COVID booster. And thank you, Kimberly. I appreciate that. Keep in mind that everybody's medical information might be a little bit different depending on their individualized circumstances. But we do now have a link in chat for.
Actually, yep. That went to hosts and panelists, so I just made sure.
Okay, just went to everybody. Awesome.
Yeah.
So you can click on that, and we'll also put that in the email that goes out after the webinar. Great. Thanks.
Yeah. So it's on that page that you'll see that there's an option to host a vaccine clinic. And if you're interested, that you can go through filling out that form. But just, to like level set the expectations, the outreach, the getting the folks, that's going to be on the host partner. What we do is get you connected with the provider to get the shots in the arms.
Right. It's one thing to have a clinic. It's another thing to get people to show up at the clinic.
Absolutely. So. Yeah. We've been doing a lot of work like at Grange fairs and trying to reach our rural populations. And we'll set an entire team out for the full day and get maybe two people, which, those are two people that were otherwise not vaccinated.
Sure. And you read in the news about a lot of people who think if they live in a more rural community or if they work exclusively from home, that they really don't need the vaccine. But I'm sure most healthcare providers would tell you differently.
Absolutely. Yes. Yeah, we are encouraging everybody to get the vaccine unless there's a medical reason that your physician has advised you around. Okay, so just to get into testing a little bit. So I'm sure most, if not everybody's aware that there's two primary testing resources out there. There's the antigen rapid testing and the PCR testing. And there's a lot of conversation right now around, and it goes in coordination with these vaccine mandates and what's happening in our schools. But this test to stay. So if you're not getting a vaccine or you can't get a vaccine, then can you test to stay in whatever setting is mandating this vaccine or this requirement? Right now, the CDC has not recommended that those rapid test antigen tests be utilized in that way. The state has not recommended that. What is happening, though, is the CDC has started to say that the test to stay is a promising practice in schools, but they haven't indicated exactly which test and how that would be utilized. So I just wanted to make sure that folks sort of have an awareness of where we're at with the trends in testing. At the state level, we have not recommended that the rapid antigen test be utilized as a way to keep unvaccinated folks in their current settings. PCR tests and pooled PCR tests are a different story. They are far more reliable than the rapid antigen tests. And the rapid antigen test, there's another slew of issues. Some of them are over the counter. They're not, the positive cases aren't reported in the same way. So there's a lot of issues with the rapid antigen test, but I know that there's an increase in the demand for rapid antigen tests, and folks would like for that to kind of serve the same purpose as a PCR test, but they really don't just yet. They just haven't developed in a way that they're as reliable. So I wanted to just make sure that folks have an understanding of that. I think in particular, as we're seeing more mandates grow and develop. So we know like Philadelphia has a mandate now for all their healthcare workers that it's not vaccinate or test, it's vaccinate or terminate. So to address that, I did want to just say to folks what we've been seeing both at a city, state, and national level around this vaccinate and terminate. The trend is around quarter of folks will say, I'm going to quit. I am not going to become vaccinated, which is scary because, as Amy mentioned earlier, and we all are aware, there's a staffing shortage in a variety of sectors right now, and some more than others. So that I think causes a lot of consternation among folks when they hear, 25% of the folks that aren't vaccinated say that they are going to quit it. But what we're finding actually, and this is again and again and again, when push comes to shove and it's down to the wire and these folks actually need to be vaccinated or they actually need to leave, only 1 to 2% of them are actually quitting. So there's a disparity between how many folks are saying that they're going to quit in surveys to their bosses, and how many actually quit when the mandate of vaccinate or terminate is put into place. So I wanted to make sure that folks are aware of that because we have a growing amount of data that is supporting that, like I said, at city, state, and at federal levels. I think that I've covered everything that I thought might be salient for this group, but I'm more than happy to answer any questions or address anything.
Sure. So I've got a couple for you, and please feel free, everybody, if you have additional questions for Faith, we're going to let her go in a couple minutes. So if you have any additional questions, get those in. I think we're in such an interesting part of the pandemic now because the mandates are largely gone as far as what you can and can't do. And a lot of it is what you should do. The CDC gives guidance. But as we head into the winter, I think what a lot of employers are asking is, might there be anything else coming down the pike on the state level that we need to be thinking about? So, and I know you can't predict the future, but as far as what else might be coming down the pike on the sort of a regulatory piece from the state?
Sure. Yeah. I mean, you're right. There's been a lot that's changed. And I think the leadership at the state doesn't have much of an appetite to create those statewide regulations or restrictions. We, as evidenced through the masking order, we will if we really feel like the decision making at the local level is not matching what the public health needs are. However, there is much less of an appetite to do anything like reducing capacity or create any sort of restrictions along those lines. So I know that, that's actually at an administration level that the appetite around that has really diminished, and that what we would really love to see is that these decisions are made at a local level in the private business sector in accordance with what makes sense for that group. Again, we will step in if we feel like that, it really is neglecting public health, but that's kind of, it's a stronger standard.
Makes sense. In general, health and safety because Pennsylvania is such an interesting state because we've got the large urban areas, but then we've got very rural areas, and what makes sense in one part of the state may not make sense in another part of the state. So I think that resonates probably with a lot of employers. So, okay. There is a question that came in, but it's more for me than for you. So I think we're going to let you go, Faith, but thank you so much. This has been extremely helpful, and you've been so good. We're probably going to ask you to come back. So
yeah, my pleasure.
Okay. Wonderful.
All right.
All right.
Thank
Take
you.
care.
All right. You too. Bye-bye.